My name is Dr Castro. I'm a heart surgeon at Sequoia Hospital in Northern California, specializing in complex heart valve disease, and would like to share some information with you about aortic valve operations. The aortic valve is normally a beautifully robust and extremely durable 3-leaflet valve that opens and closes, directing blood from the heart to the rest of your body. For most of us, this valve will last a lifetime. But for some, the aortic valve develops progressive calcification or wear and tear over many years, causing a narrowing and obstruction to normal blood flow, also referred to as aortic stenosis, or less commonly, not closed correctly, a leaky or regurgitant valve, also known as aortic insufficiency. As this progresses, most people begin to feel symptoms which include progressive shortness of breath, easy fatigability, or even chest discomfort. Some patients may faint with severely advanced valve disease. But for other patients, because this process occurs slowly over many years, very few symptoms are recognized. It is not uncommon for people to become less active, tire more easily, begin to sleep more during the day, lose interest in daily activities, and blame most of this process to aging or not notice it at all. Here's the great news. Following recovery after aortic valve surgery, it is not uncommon for the vast majority of patients to feel much more energy and to be much more active, even if they felt few symptoms before the operation. Lots of aortic valve options are available to you. Newer investigational technologies are permitting patients who would be considered too high risk or too sick for conventional surgery to undergo aortic valve procedures. But for most patients, even elderly patients well into their mid-90s, standard valve repair or replacement is still the safest and most durable operation. In experienced hands, aortic valve surgery is extremely low risk, can be performed through minimally invasive approaches, and can have a tremendous impact on the quality of life following surgery. Remember to ask those tough but very important questions when interviewing your surgeon. What are the chances of surviving the operation? If you're under the age of 80, your operative risk should be less than 1%. How many aortic valve operations does the surgeon perform a year? There's going to be a difference in experience between a surgeon who performs less than 10 valve operations a year to those surgeons that perform greater than 100 valve operations per year. Ask about tissue heart valves versus mechanical heart valves. These are personal decisions based on lifestyle that should not be decided upon by your surgeon. What other complications are related to the procedure? Is there a higher complication rate, for example, stroke, with less invasive or percutaneous approaches? Can your heart surgeon perform the operation through minimally invasive approaches without increasing the risk of surgery or the risk of operation? I hope that some of this information has been helpful to you. My name is Dr Castro. Please feel free to contact me with any questions related to this topic or others related to heart conditions that may require operation. Thank you very much.